You may already be familiar with the terms dementia and Alzheimer's disease. First, let's take a look at the distinction between dementia and Alzheimer's. Dementia is a general decline in the functioning of the brain, to the extent that routine tasks and activities become challenging. It's caused by nerve cells in the brain dying off. Typically, dementia results in memory loss, confusion, personality changes, language problems, and loss of visual and spatial abilities. Now, dementia itself is not a disease. Rather, it's this collection of symptoms which can have any of several underlying causes. Alcohol or substance abuse, some blood conditions, nutritional deficiencies, and severe head injury can all bring on dementia. Happily, in these cases, it's often treatable, and full or partial recovery is possible. Alzheimer's, like other causes such as stroke and CJD, is not treatable. This doesn't mean that nothing can be done. What it does mean is that the progress of the disease can only be slowed, not stopped or reversed. Also known as AD, Alzheimer's disease tends to come on late in life, and it's estimated that half the people over 80 have the condition. It tends to advance slowly, sometimes taking several decades to run its course. Memory loss and absent-mindedness are usually the first symptoms. Eventually, a person with AD will need round-the-clock care. So what does Alzheimer's actually do to the brain? The exact mechanism is still unknown, but two forms of nerve damage seem to be implicated. First, the normally straight filaments that keep nerve cells intact become tangled. Second, a sticky substance called amyloid accumulates around the cells, making them malfunction. The main risk factor for Alzheimer's is old age. The disease affects slightly more women than men. Obesity, diabetes, an inactive lifestyle, smoking, and other habits or conditions that raise blood pressure can increase the risk of AD. Several medications are available to slow the progress of Alzheimer's. Tantalizing research has hinted that keeping the brain active and engaged can not only combat symptoms of Alzheimer's and slow its advance, but may even reduce the risk of getting the disease in the first place. The theory is that your brain is like a muscle. The more you use it, the stronger and more resilient it becomes. Your brain gets stimulated. Increased blood flow brings extra nourishment to nerve cells. New connections are established between them. Some researchers speculate that a stimulated brain may even grow new cells. So, for a supposedly untreatable disease, there's a lot you can do to fight Alzheimer's.